Hello, Jonathan. So as you are aware about all the hospital policies and procedure, now it's time to begin with the procedure of hand washing. Hand washing is also known as hand hygiene, and it is a technique to wash our hands with an antiseptic solution or a soap to remove the extent of microorganisms and pathogens like bacteria and viruses from our hands. So like hand washing is done to reduce the extent of pathogens and bacteria, and with the help of the chemical action and the mechanical friction. So now the main purpose of the hand washing is to remove the extent of microorganisms and pathogens, and to reduce the transmission of infection from one person to another, and to reduce the spread of infection from oneself, and to reduce the amount of iatrogenic infections and the nosocomial infections. So before beginning with hand washing, we should always determine the need of hand washing. We should always do the hand wash before and end of the shift, before entering the patient's room, and before touching any sterile objects or equipment, and while handling the assistants and doctors and physicians and nurses. And then we have to always wash our hands before having our nails. Then we have to always determine that our nails should be short, not long, because short nails are easy to wash, because on the long nails microorganisms can harbor on the tip of the long nails, and it can make us hard to clean the hands. Then now we will, before beginning with the procedure, firstly we have to remove the ornaments, because if we will not remove the ornaments, the microorganisms can lodge in the settings of the jewelry and ornaments, and can lead to the increased chances of spread of the infection. Then we have to maintain the correct body posture. Our clothing should not touch the covering of the sink, because if our clothing or body surface will come in contact with the sink, then it can lead to the increased chances of infection. Then turn on the tap at a moderate level. If we will turn on the tap at a moderate level, it can reduce the chances of splashing and the further transmission of infections. And then you have to check the water level of the water level. It should be moderate, or lukewarm or warm water should be there, because it can lead to it will not remove the excessive protective oil from our skin. Then now you have to always maintain the body posture, your hand posture like this. Your tip of your forearm and the finger should be below the tip of the elbow level. So firstly we should rinse our forearm and the fingers. We should always ensure that they should be like this, so that water cannot drip back to our forearm. And then we have to apply the 2 to 4 ml of the water soap. So be ensure that if we are using the soap bar, you have to always rinse the soap bar before placing it to the soap dish, and then apply the soap from the least contaminated area to the least contaminated area to the most contaminated area in a circular motion, and stop at the wrist. Same as in the second hand. And then we have to clean the back of the hand in the circulatory motion. We ensure that your clothing should not touch the sink. And then same as on the back hand. And the interlocking of the fingers, because the microorganisms can lodge over here of the both hands. And then the thumbs, and then the tips of the fingers, so that the top of the fingers cannot come into contact with the microorganisms anymore, and to reduce the spread of infection. And then the sides of the hands, both sides, to ensure the proper hand washing. And then you have to rinse your hands and arm in a rotatory motion and in an appropriate way. Be ensure that your hands should not touch the sink level. And then you have to take the paper towel. Be ensure that separate paper towel should be used for individual hands to reduce the spread of the infection, and then discard into the dustbin. Same as from the second hand. And then take the last paper to turn off the tap. Because if we will touch the tab with our bare hand, then it can again lead to the spread of infection, and then clean the surface around the skin so that it can lead to the asepsis and sterile condition. So this is all about the hand washing. So if you have any questions or queries, let me know. I'll help you out with a well-informed manner and in a detailed and precise manner. Thank you.